Good afternoon. My name is Martta Ylilauri. I work at the University of Vaasa, and this webinar is part 2 concerning the challenges and opportunities of nature-based services, especially in Finland and Sweden. And we start this webinar by the Swedish part, and Päivi Juuso from Luleå University of Technology is giving the first part of this presentation, and then I continue with conclusions concerning both Finland and Sweden, and then some recommendations.
Hello, I'm Päivi Juuso from Luleå University of Technology. I'm a senior lecturer, but also project leader in Nordic NaBS on the Swedish side. And in this part, I will describe you some of the results from the Swedish side. The contents of the webinar is, in this part 2, nature-based services in Sweden, as I told you previously. I will describe you some of the structures and cooperation models, supply and demand, strengths and opportunities, weaknesses and threats, including barriers for services. Thereafter, the webinar will continue with some conclusions, first from Sweden, but thereafter for conclusions for both countries, meaning Finland and Sweden. We have some references to Norway and end this session of the webinar with recommendations to be implemented in the project. So we continue with the Swedish part of the results. Nature-based services in Sweden and in case regions are described based on document analysis, survey, where we had 34 participants, and interviews with 17 participants. And the content will be, as I told you previously, structures and cooperation models, supply and demand, strengths and opportunities, and weaknesses and threats, including barriers. First, I will describe you some of the supply and demand of this green care, or usually called grön omsorg, or other nature-based services in Sweden. And in Sweden, there are different concepts used for the services. For example, grön arena, nature-based rehabilitation, or naturunderstödd rehabilitering, gröna rehab. These are actually concepts different from this grön omsorg, which of course is also described and used. Hushållningssällskapet are responsible for the grön arena concept in Sweden. And this is a concept and a cooperation where nature-based service providers can gather together and get support and education, etc. through Hushållningssällskapet. Grön Arena works all over the Sweden. There are 8 regional areas with 8 local project leaders. And up to date, there is 80 certified Grön Arena farms in Sweden, but of these, there is just a handful part in the northern parts of the country. Many of the nature-based service providers do, however, not participate in associations, as you understand, related to the quite low amount of Grön Arena farms in Sweden. Naturunderstödd rehabilitation is prescribed by the healthcare and is a complement to medical care for people with mild mental illness, exhaustion disorders, or people on sick leave. All these services are mainly in the south of Sweden, so there is quite a few of these in the northern parts of Sweden, and the demand of the services is still quite low, actually nationally, not only in the northern parts of Sweden. If you are interested and keen on knowing what actually the definition of these green care or grön omsorg concepts are, you can look at webinar 1 where we have a description about this. However, in this study, looking at the companies participating in Nordic NaBS, they offer services such as animal-assisted services, gardening, farming, outdoor guides, forest bathing, and ecotourism. This is good to have in mind when you look at the answers from the results, which I will describe now. I will continue with describing strengths and opportunities related to the theme knowledge, professional skills and qualities, and this is specific for the case region in Sweden, meaning the north part of Sweden and Norrbotten and Västerbotten. Some strengths and opportunities is actually that there is a high competence among nature-based service providers, the experience-based knowledge and the effect of the services on people, and also actually the existing evidence base within the field, nationally and internationally, facilitate development of the businesses and services. There is a knowledge that nature-based services decrease the use of healthcare services and increase the possibilities for legitimacy within the business. This is also seen as a strength in this region. Flexibility among nature-based service providers increase the possibility to offer services suitable for different groups of clients. When we look at strengths and opportunities in the Swedish case regions, I describe operational environment and institutional structures as a theme, where we can see that from the results that the region's unique environment, the availability and closeness to nature and service, which is right in time, related also to the society's quest to sustainable health solutions and protection of nature, increase the possibility to develop nature-based services. The environment around some of the public actors, organizations have natural settings that could suit for a nature-based services, meaning that, for example, around hospitals or other healthcare institutions, you commonly see small parks or green areas, which could actually be suitable for these kind of services. The services can be a complement to existing treatments of various illness states, such as anxiety and stress-related disorders, which you also could see was common if you look at other parts of the country nationally. Also as an early intervention for people with risk of exclusion, isolation and loneliness was something that was lifted up as a strength in our results. The service should be possible to prescribe, but also be a part of the welfare society's offer for health promoting activities, was also a part of the results. Looking at strengths and opportunities related to actors, networks and activities, the results show that good cooperation between public health sector or public sector in general and entrepreneurs was seen as an opportunity to enhance dialogue and increase knowledge about nature-based services and to also market the services. Cooperation and support between entrepreneurs within the nature-based services increase the possibilities to get sustainable solutions for the businesses and to decrease costs for marketing, meaning that not only cooperation with the public sector actors, but also together with each other in the same business is a strength in this case region. Cooperation with Grön Arena was also by entrepreneurs seen as a strength, as it further increases their possibilities to be a part of a larger community, meaning they will not be so alone in their own business. The entrepreneurs, but also the clients' subjective experiences of good results from nature-based services on illness was seen as a strength, increasing the possibility to cost-effective results. So the results show that some of the respondents have experience and also therefore mean that the client's subjective experiences have shown good results, which could also be a basis for developing these services. There is also a common belief that these services will increase in the near future and be a complement to traditional treatment and increase health promoting activities. We will continue with weaknesses and threats related to the case region of Norrbotten and Västerbotten, and we'll continue to describe these related to the themes I have described previously. And in this slide you can see weaknesses and threats related to knowledge, professional skills and qualities. And lack of knowledge and understanding about the value of nature-based services among actors in public sector, as well as disbelief about the effect of nature-based services as health-promoting intervention was one of the results related to as a weakness and a threat for developing these services. Different concepts are used for the same kind of services, leading to lack of understanding and coherence, which could actually increase knowledge among actors in public sector as well as the society, meaning that the use of different concepts increases a confusion about what are the services actually meaning and in what way should the society, but also the actors in public sector, understand these services. Another weakness and threat is the lack of credibility and legitimacy. Of course, this is closely related to the point I just described previously about different concepts and the lack of coherence. There is also a weakness related to uncertainty among entrepreneurs as well as among actors in public sector about what they can or might have the right to do or not to do related to laws, legislations and purchasing processes. Looking at weaknesses and threats related to operational environment and institutional structures. It becomes obvious through the results that there is a dependency on political decisions and lack of them leads to uncertainty and decreased possibilities to plan ahead for entrepreneurs and actors in public sector. There is also lack of or uncertain quality certification of the services, which could increase the credibility of and status of these services. And it is hard to set a price on the service as there is a lack of consensus and guidelines and availability and accessibility of the businesses and where they are located, and especially if it's outside central city, is seen as a weakness for development of the services. And there is also differences in possibilities to offer and develop the services nationally. So this natural incoherence is also lifted up as a weakness and a threat for continuing development in the case regions Norrbotten and Västerbotten. Related to actors, networks and activities, the results show that some of the weaknesses and threats are related to lack of courage to try innovative solutions for clients' health promotion. And this lack of courage is actually something available among actors in public sector, but also among entrepreneurs in some sense, and is related to a high level of uncertainty. And there is a weakness related to that. There is a need to meet the right person in order to spread the information and market the services. So if you meet the right person, there is one enthusiast, which actually also makes the cooperation uncertain and vulnerable in long run, if it just depends on one person, for example, in the among actors in public sector. There is no sustainable solutions regarding cooperation, contracts, etc., etc., and the financing is hard to get profitable, as the companies are too small or unknown to be a part of the purchasing processes, which, for example, are done by healthcare services or actors in other public sectors. When getting contracts, which actually happens, and these are for short time, and which also increase uncertainty for the service provider, but also the actor in public sector, and of course for the client, and as there is no sustainability in this kind of service offerings. I will take shortly just about the conclusions in related to the Swedish part of the results, which show that there is actually in these case regions pioneer entrepreneurs also in Sweden. But there is still a need for more information about nature-based services and their effect, good regional examples and cooperation models. Research within the area is seen as important in order to increase the business's legitimacy. And in Sweden, there is actually a lot of high quality research about nature-based rehabilitation, for example, and its effect. But it's mainly from the south of Sweden, which we conclude could actually be a foundation for implementation and services in the north part of Sweden, but also in Finland, of course. In Sweden, there is no uniform concept for the nature-based services, which creates confusion in marketing, but also for knowledge of what the offer entails, for example, for buyers and customers. So there is, as I mentioned previously, hard to understand what these different nature-based services actually are, as there is no common concept used for them. Well then I end the Swedish part of the webinar, and thank you for that. We will continue with the conclusions for both Finland and Sweden, and also a short description of the Norwegian side of the part, and where you can listen to that, and of course also about the recommendations we have related to this project and what we can do during this project period. Thank you for me.
Conclusions. What were the main points concerning Finland and Sweden of this whole study? Well, first, concerning the global megatrends, the time for developing these nature-based services is absolutely right. All these megatrends with climate change discourse and all these nature, healthcare and well-being issues in all these social medias and in public medias had brought the general acceptance for this theme. And in Finland, we have this wide-ranging interpretation of green care concept that enables this interdisciplinary networking and also cooperation between different kind of professionals, which is very important. And we have this Finnish National Association and coordination. And for instance, yearly conferences, websites that are updated regularly, and research network, including all these green care quality management work and green care education courses, which have the similar criteria all around Finland. I think they could be somehow benchmarked to Sweden. And then we have pioneer entrepreneurs and also other actors in all case regions in Finland, but there's still a need to more information about the nature-based services in general and the effects, but also the good regional examples and cooperation models. Then, though we have these pioneers and we have these great examples, the critical mass is still missing in most of the case regions. There are few smaller groups or clients who have the possibility to use these services even regularly, but the bigger use of these services is still missing. And there is a need for more courage and maybe less preconceptions among the buyers of these services regarding these experiments of new service forms. So it's important that we have this quality criteria and internal quality control, because it adds confidence for those who are testing or using the services first time. And for the entrepreneurs, the economic profitability of nature-based activities needs very much to be enhanced, because many of these actors are doing it as a part-time job, and it's sometimes very difficult to set the price that is sustainable also economically. And that's why this has to be connected to business skills and also effective marketing. There's a very crucial role of cooperation and networks. So all these platforms of networks have to be very easily accessible by different actors. For instance, some benchmark groups that you can openly discuss about your own problems or issues. At the same time, you don't have to be afraid that someone is using that against you or other competitors. And also that you have these local networks that you can cooperate with, for instance, marketing, and have these meetings with different kind of organizations who are sending their clients to the entrepreneurs. And also the client's accessibility to services is in a major role. And often it means that the support of transportations are needed. It can be financial support, or even a vehicle, a car, a bus or taxi transportation. We have had this Northern Norway within this study, and we have done it with cooperation with HLB, Dr. Rhys Evans and his colleagues. And the object for their mandate was to produce and analyze information regarding these regional significance, characteristic features in Norway, opportunities and boundary conditions of nature-based activities from the perspectives of social, healthcare and pedagogic sectors, same sectors as we have had in this study in Finland and Sweden. And we have also been interested about the perspective of entrepreneurship, especially in Norway, and the importunate concept. And the presentation concerning Norway is published separately. It's going to be on the YouTube channel, and then also the materials are published on the websites. And these are coming out on March this year. And also, if you're interested about more details, including Finland, Sweden, also Norway, all these material are published in our project website. Then the recommendations in this project. And now Finland and Sweden are the actors and the regions which are in this project. So these recommendations concerns Finland and Sweden. First, knowledge and professional skills as well as qualities. What is to be done is more general informing about nature-based methods and their effects, both research and also there's evidence-based and practical information about these services. Then enterprise and service-specific marketing communication is needed and should be notably strengthened and diversified in the whole project area, both in Finland and in Sweden. We need to support the quality management of different actors, concerning also the entrepreneurs, but also other actors who are using the services, so that we are talking about the same quality criteria. There's a need to support business management skills, especially in small enterprises. And we need more evidencing the impacts of nature-based activities. And it's good to use all these valid evaluation tools that are available, including indicators and other analyzing methods. Then when we talk about the operational environment and institutional structures, it's very important to benchmark these real examples, what we already have, to show that providing these nature-based services and using the services, they have helped the clients, give the examples, and also give the information of how these activities have enabled to maintain the farm viable, because we have also this kind of examples in this project area. All kinds of communication should be strengthened, especially towards smaller farms and other entrepreneurs, and these social healthcare and pedagogic organizations who are clients now or potential clients. And all this should be as easy and simple as possible for all these actors, because days are long and there's a lot of things to do, so that it should be very easy to take a contact or check what's going on or which kind of services are available and who can people contact and so on. It's also important to recognize, and the project could help to people to recognize which are the service models that should be more reasonable, maybe easier or cheaper to buy than produce self by these different social healthcare pedagogic actors. And often it's so that, for instance, farm activities or animal assisted services or services concerning water areas, if you have to have kayaks or when you're canoeing or having this fishing equipment and so on. Or you need some premises like farms and stables, as well as these well-educated professionals and animals. So in many cases, it's more reasonable to buy the services than try to produce them by themselves when talking about the client organizations. Then different requirements of authorities regarding entrepreneurs who are willing to offer private social and healthcare services. These criteria has to be investigated and taken in advance into account when we try to develop these nature-based services. It can be also important to get some support with contracts and different kind of cooperation models. And one task for this project is to make this systematic evaluation regarding cost effectiveness, because economics counts, and if we can show the real calculation concerning the costs and also the advantages of these nature-based services, so it would be help the decision making in the future. And that's why the project have to find these good examples from Finland and from Sweden to make this analysis and start the evaluation about this costs and benefits. Then concerning actors, networks and activities, it's important to strengthen the cooperation, and all these networks and platforms have to be easily accessible by different actors, so that as I mentioned earlier, so that it's easy to find these platforms and networks and participate on them. And there has to be regional networks, of course, with the people you work with, but also have these international examples and networks, and to be able to compare and benchmark the activities, for instance, from the other countries. And then these discussion forums, they are easy to create as to combine people from different countries, because then it's easier to participate from each region we have within this project. And it came out from this study, and these pilot experiences are in a very crucial role. And the project can support to find the entrepreneurs and actors in the social healthcare pedagogy sector with a real willingness to develop their service models and create service models that should have demand and precondition also to continue after the project. So it's important to find well-working and economically sustainable cooperation in all levels, and to bring innovative actors together to conduct high-class experience, and then to create trust that makes sustainable partnerships. And in this project, we have a great opportunity to pick up the best features of the Nordic nature-based services and concepts, to apply these concepts in different areas. And we think it's worth utilizing all these chances what the project can support among enterprises, but also all these client organizations. And it even came out some ideas for the future, maybe after the project, that there should be good to have a regional center, regional reservation centers, or for nature-based services, or digital marketplaces, some kind of NaBS booking.com, or to get these transportation optimized. For instance, green taxi or something, some route who is collecting clients certain day, certain place every week, and so on. And also these regional organizations or coordinators, facilitators, or even brokers who could combine these entrepreneurs and clients effectively, and also could assistance and help with contracts and so on. And if you're interested about more precise information concerning this study, so please check our project websites and YouTube channels. There is the part 1 of this webinar, and you can also contact us, Olli, Voutilainen, me, and Päivi, Juuso, if you want to discuss about these different parts of this survey. Thank you very much.